Good morning. I'm going to do an incentive spirometry. So the first thing I'm going to do is check the patient's chart to see what patient I will be having, if they are a post-op patient or if they're just elderly patient that needs to be working on their exercising of the lungs. So once I'm ready to enter the room, I'll knock on the door, introduce myself. So hi, my name is Amy and I'm a respiratory care student with the respiratory care department. And then I would check the ID band just to make sure I have the appropriate patient, check their name and date of birth. So once I have that and everything checks out, then I'm going to wash my hands before I begin the treatment. And also apply gloving just that way I don't spread anything, make sure my hands are nice and clean. So here I'm going to explain to the patient what I'm going to be doing. So I have a volumetric exerciser here, and so this is just going to help them with their inspired volume, just to help them keep their lungs going and to be able to cough up anything. And if they're post-op patients, just this will help them keep the lungs open, the way they don't get atelectasis. So here we have the machine here, the volumetric exerciser machine. And so with this machine, it has a set inspired volume, and there's a chart to follow by. So there's female and male, and so I'm gonna do me as sedation. So I have age and height, and so I'll be between 1900 and 1850, around there. And so then I'll set the flow wherever it needs to be. And if they're a post-op patient or even an elderly patient that can't seem to get their right volume, then we will have them start them at a lower portion volume. That way they can set a goal to where they need to be and continue to practice until they get to that goal. So when I'm ready, I'll get the mouthpiece ready, and then I will talk them through it and demonstrate to them how they will be using their machine. So I will tell them they need to take a deep breath in and then fully exhale. And then when they go to inhale again, have them put their mouth around the mouthpiece. Make sure their tongue is underneath the mouthpiece and not occluding the opening of the mouthpiece. And then when they inhale, they need to hold it 3 to 5 seconds, or at least until the piston goes down to the bottom. And then once it's down to the bottom, I'll have the patient take the mouthpiece out and exhale normally out. And so first thing, so I'm going to demonstrate. So I'll take a deep breath in, and then exhale. And then I will exhale off to the side. Now if the patient is able to do it and it seems to be capable to do it, I'll have them do it 6 to 10 times per hour, just depending on how they're feeling with it. And if they're a post-op patient, I can have them sit up with a pillow, that way they are comfortable when they are doing it. And then if they are not quite done, I can set it next to their bed here, that way they can reach it, and just let them know that when they do it, they have to be sitting up, and I can come back in to make sure they're doing it properly and getting the effectiveness that they need to have for it. And if they're finished, I will remove this, and then if they're completely done and they're ready to go home, we can wash the mouthpiece off here, wash the mouthpiece, dry, make sure it's air dry, put it in a special place, that way they can take it home with them to continue to practice. And with this machine, they are able to put the patient's name on there, patient's room number, and the date that I have given them the machine, that way they can continue to practice at home. So I will set it in appropriate bagging when they are done, and make sure it sets up right. And then I will always reassess the patient, and if they have to do it multiple times, then make sure that they get the rest in between every treatment, that way they don't hyperventilate or anything like that, or don't feel like they're gonna pass out. So when I'm done with the treatment, I'll wash my hands, dry them, then I will reassess the patient. I'll check their vital signs to make sure everything looks good, and then I will listen to the lungs to see if it's helping their lungs and see if I hear any abnormalities with it. And when I'm done, I'll clean my hands, wash my hands again, and then I will go out and chart on the patient's charts and let the physician or nurse know what I have done for the patient.